Thank you for joining us on this day. I am Lennox Wasara, and of course, I'm joined by our Vice-Chancellor, Professor Tawana Kupe. Prof, thank you for joining us today.
Thank you, Lennox. I love your podcast. Keep it up.
Thanks, Prof. It's great to have you here, but great to have you to talk about something else. We heard a little bit about other universities that are starting to consider making vaccinations mandatory to their staff and students. Keen to hear the university's stance on this. What's your stance on that issue?
Yeah, I'm not keen, and at this time we're not keen on making vaccinations mandatory, and I'll say why in a short while. Let me just also say that we've agreed, as the committee of medical school deans agreed, that in the health sciences environment, people must vaccinate. There's mandatory vaccination in that area, and there's a good reason for that. Right. People work with their front-facing to patients and all of that, so they shouldn't get ill themselves, and they should also be in a situation where they put those they render healthcare services at risk. So on that one, we're together with all of the other universities, especially those universities with medical schools. On the generality of the university population, I'm not for mandatory vaccination at this point in time. We might get there, but I actually hope we never get there. And these are my reasons, is that I think we should actually give a chance for encouragement, persuasion, and peer discussions to, enable people to be able to make a decision to vaccinate. Let me be clear, at the University of Pretoria, we strongly endorse vaccination. We want everybody to have vaccinated like yesterday. If they haven't vaccinated by now, please, they must do so as soon as possible. And now we are allowing people to actually book for vaccinations at our site at Health Sciences, on the student portal and on the staff portal through PeopleSoft. So, and also we likely also soon to actually, as logistics allow, create pop-up vaccination sites on some of the campuses, particularly the larger campus like the Hatfield campus. So the reason why we prefer encouragement, persuasion, and people discussing with their peers is that we're a university. Mm-hmm. What is the role of a university? The role of a university is to spread knowledge and to let people be persuaded by knowledge, by scientific arguments. When you go the route immediately of mandatory vaccination, you in a sense undermine that broader aim. Of course, you can say the pandemic is a particular kind of situation, which says to you, you must force people to vaccinate. But careful what you do, you might actually undermine the broader goal of what a university stands for. Because remember that it's not only in universities that you are finding people who are procrastinating rather, and not vaccinating. And we prefer using the arts and music as well, vaccinate, do not procrastinate. Our students at Health Sciences did a wonderful rap song on that. We prefer more of that. It's important very much for people to be persuaded, because as I say, it's not only university people who are procrastinating, it's people in society in general, for a variety of reasons: cultural, religious, lack of sufficient information, no persuasive arguments that appeal to a particular person.
Absolutely. I like that sense of getting buy-in, which is very important. Yeah. And another stakeholder group that's important to get buy-in from are the parents. Yeah. And we've heard the parents have been complaining that other universities are opening their campuses to students. Your thoughts on why UP is not doing this yet?
Yeah, but let me just be clear. I think there's a misunderstanding in the public domain. Right. All universities are not open to the public. There is no mass-scale contact teaching. What all universities are doing is that targeted contact teaching. So in the health sciences, our students have to be there. In those disciplines at the University of Pretoria, where students have to do lab work, for example, or practical work, we are allowing them in small, manageable groups under proper health conditions. And let me just say also, as a general statement through my discussion with you here, is one principal drivers: the health and safety of our staff and students actually matter. And so we put that at the forefront. But we also then enable people to be able to do contact teaching as you do. Yesterday, I was taking some visitors to the Engineering 4.0 complex. They were students working in a lab, but they were rotating in large numbers, in small groups. So where they are safe enough, is sanitized. Whatever they touch is then sanitized. They're all wearing masks in their sanitation stations. That's what all universities are doing. I think the confusion in the public mind is what people will do next year in 2022. So the universities that are saying people must be compulsorily vaccinated are saying to them that this is as I understand it, because there's sort of lots of confusion about what's happening.
Yeah.
They are suggesting also that next year, if everyone is vaccinated, they could hold large mass scale contact classes. At UP, we also are aiming to have more contact classes next year. People actually on campus in large numbers, but in numbers that are then managed per capacity of rooms, depending on the health regulations that pertain there. So because remember that we actually don't know when January, February comes, what level lockdown will be.
Yeah.
We could be back to level 4.
Yeah, it's very uncertain.
Which is not where you cannot hold large-scale classes. Remember that many lecture rooms were not designed necessarily to hold capacities that are allowed under lockdown regulations. If it's a 500 lecture, it will take 500 students sitting next to each other.
Yeah.
If you now have to say half the capacity of the room, you have a problem if you're going to run contact classes. But the more people you are, if the infections are high, you have another problem in that the risk of infection rises. And when the risk of infection rises with large numbers, you get a cluster outbreak. It becomes a super spreader event.
Yeah.
And actually you compound a situation that is already bad.
Absolutely. I see the university taking a bit of a step to ensure that we avoid that cluster outbreak.
Yes, exactly.
Being
and
proactive.
avoid super spreader events. Yeah.
Absolutely.
Yeah.
I guess that's the stance you've taken as well. And I guess there's been some parents as well, whilst we're still speaking about parents who may be paying for contact fees where their children are attending classes online. There are students who are now probably in their second year who haven't set foot on campus.
Yes,
I don't know how the turnstiles work, don't know how to use a student card to get onto campus. Why isn't UP charging a reduced fee since it's all online?
Yes, on the face of it, it looks like simply being online is cheaper, but actually it's not. Remember that the online costs, especially the staff costs, are not any different. Whether a person is standing in front of class or teaching online, it's the same professor, it's the same academic with the same salary that I pay. So the costs have actually not gone down. Second, there are actually new costs when it comes to online. You know that we outlay data, not to everybody, of course, on demand, but the people needing data to go online for learning purposes has grown higher. I think this year it's around 30,000 of our students have at one point or another requested data. Those were costs that we cannot incur from anywhere else except from the tuition fees, if you like. Then, of course, there is the infrastructure behind the teaching and the online teaching and learning. Maintaining software licenses, buying new licenses for people to use online, the video equipment that we actually use, the technical equipment that we actually have had to upgrade, particular equipment to give a certain level of quality to our online teaching. Because remember, at UP, we're running a sophisticated operation. It's not just slides, videos, post them, then everybody can do it. We're actually running live, synchronous classes. Right.
Sure.
And that requires a particular technical infrastructure, which we have to pay for. So the cost actually could have gone up, but we are maintaining the same level of fees, if you like. It's understandable where the public is coming because they think that contact is much more expensive. It's not actually the whether the person is there present in front of you. It's that there is a person who has to, and there is the technology that has to support all of that. And also there's the technology for supporting online assessments. And now we're trying to look for technology also to ensure people don't cheat.
Yeah, exactly. Yeah,
it's going to cost money. Yeah.
Absolutely.
So then also the second question you raise is very important. Something that keeps me awake all the time. A person who has never stepped onto campus, who was so very much looking forward to being on campus when they finish matric. This is a situation beyond everybody else's. We could do that and have large numbers of first years or second years on campus. Get a super spreader event, we'll be back to square one. We'd have to shut down the place. In fact, the health authorities would shut us down. Shut down the place, sanitize it, let those people recover, and hopefully nobody would be so sick they pass on. Even if they do not pass on, the burden of a person being sick because we didn't do the responsible thing and emphasize safeties. So that is why we're hoping that mass-scale vaccinations, and that vaccinations we know are effective. They reduce the risk of being infected. They reduce the risk of falling seriously ill. They reduce the risk if you fall ill that you'll be on a ventilator and need high care and lose your life. That if that could happen, not just for people who are UP people, but in society in general, because our people come from society. They're not they're not UP people. It's not a country in its own right. Right, that will actually enable us to have safe and healthy conditions for everybody to be on campus, and those first years, second years who have never been in campus can roam freely on campus and enjoy the facilities.
Absolutely, almost avoiding the whole sense of like going forward and then taking two steps back, whilst rushing to make decisions.
We must build towards actually a sustainable future where we live with the virus, but the virus is not controlling what we actually do.
You spoke a lot about the data support being given to students. Is that support sustainable? Is it sufficient to the students?
It's not sustainable. We try. Well, so far, I think we've outlaid data to anyone who needs it, but the costs are increasing all of the time. And remember that the university's finances have been affected by the pandemic in two ways. People are unable to pay fees at the rate that they should pay, or even unable to pay. So the student debt is rising because of that. And each time we're owed money, we don't have that money, we can't use it for new technology, for data, and for all of that. Then second, we've also had reduced income from government grants. For example, this year, the government had to afford the NEFSAS funding, and they reduced the grants going to the universities. So it's a tough, also unsustainable situation going forward, and that is why people vaccinating, the virus being under greater control, less infections, a move towards more quote-unquote normal life, if you like, would actually put us back into a better financial situation.
Yeah, absolutely. You can imagine that the intensity of the ongoing costs, as you mentioned, just how intense it is. I'm keen to hear a little bit more about, of all the students who are presently enrolled in programs, what percentage of them are currently perhaps on campus, as you mentioned, on a rotational basis, and what percentage of them are still doing classes virtually?
Yeah, no, I don't have the figures offhand, but I can say confidently that, and regrettably, because of the virus, that it's a small percentage that is on campus coming on rotations. As I said, it will be largely the category of students where practical work is required. So you can't really complete the degree or your studies without, not just continue with your studies without being on campus in one form or another. So you find students in engineering, students in certain of the lab-based sciences, physics, chemistry, and all of that. Students in health sciences, obviously. But compared to what would be the normal situation, it's a very small percentage, but I don't have the exact same number off my head.
Okay, incredible. But it's good that we have an idea of the thinking around who comes on campus, who's not allowed on campus. Quite, I guess, justifiable, I must mention. And let's talk a little bit more about students who might not be able to complete assignments, online tests, and also that being due to internet connectivity. I don't know how those problems have been handled thus far.
So typically, I think that should be handled at the level of the lecturer or the course coordinator or the head of department. Once or twice, those things cross to me. Some students will write to me directly. I normally send that to the dean and also tell the student to inform the course coordinator. And I think sometimes you're able to prove that, you were about to post an assignment or an assessment and the network went down. I think leeway is given. My philosophy and my principle will be that leeway should be given under these difficult conditions. For people genuinely try to do something, but technological issues then defeated them, if you like. And perhaps you're out there at your home in a rural place or in a place where connectivity is good. It does not. That is why, by the way, fundamentally our system does not require people to have data to go online. However, that is not necessarily true because people connect from different environments that are not as connected as UP. If you were doing that from your res or from a lab on campus, it might work very differently, and connectivity would not be an issue. Even there are glitches on my laptop in my office. And my office is one of the most connected on campus, right?
Yeah.
And the Hatfield campus in general. So I think generally empathy, understanding, leeway, and of course there are some people, and also there are some people might try to take advantage, but there will be very few. Yeah. Who try to take advantage and blame it all on lack of connectivity when they actually hadn't done the assignment. This stuff happens, as you know.
Yeah, students always taking chances with that.
Yeah.
But I'm glad that the staff are very well prepared of all those, I guess, angles that students might try and take. I want to hear a little bit more about staff. You're very passionate about your staff at the University of Pretoria. Yeah. I want to hear a little bit more about maybe when would all staff be required to come back? Will it be mandatory? Just a conversation really around, will they need to be vaccinated if somebody does catch the virus? I'm just keen to hear your thinking around that.
Yeah. So our philosophy, if you remember from my releases, all the time when the president makes his family meeting statement, it's always followed by mine.
Yeah.
So far we'd been saying when there were high lockdown levels, we'd be saying work from home as far as is possible. So our philosophy was, if the infection rates are high, and if the pandemic is raging and the lockdown levels are high, we prefer people to work from home. But it's not ideal. There are many things that there's lots of things that cannot be done from home effectively, a delivery of a service to other staff members, to students, and all of that and all that. But we always say the health and safety of staff members matters. So work from home. So what I don't want is everybody being at the office on the same day.
They kind of miss each other. They all want to be there at the same time.
Yeah. So I once heard someone once told me that some people, when we even under higher lockdown levels, we allowed people to come in strategically to make sure if they needed to do something, but not in large numbers. It so happened in some unit somewhere that people came in large numbers, hadn't seen each other for a long time, and they started hugging. And infection spread in that particular kind of unit. And that is the danger of not of just simply saying everyone must be at work. That's why our approach is one which is very pragmatic, which is always driven by the principle. The health and safety of students and staff, we're talking staff now, matters. So manage rotations. And second, we ensure that if people in all of the spaces, there is enough sanitization equipment, people sanitize, and that surfaces are sanitized, bathrooms, common areas, kitchens, and also people should sanitize their own offices. We always have small liquid at each office for people to sanitize their own desks and the door handles and all of that, and any equipment that they might use that might be used in common. So again, we haven't made any demand that everybody comes every day to the office, but we have said to improve efficiencies, effectiveness, and working better. Because if we don't do that and the institution goes down, we don't want to get to a situation where we say the institution no longer can generate sufficient funds or finances and is not working well. Students are choosing other universities. We now have to retrench people. So you have to strike that balance as well, saving the academic project and what the institution does, saving jobs, but keeping everybody safe. So for now, now we're on level 1, we'll also have to review that. We might now say 4 times a week people should come, but again, not everybody who works in that office there at the same time every day. You manage it through rotations. There's a bigger principle here.
Yeah.
As you can see, the pandemic is not vanishing quickly. We have to learn to live with the virus. And learning to live with the virus is developing these schemes of how do you maximize working efficiently and ensuring that we save all jobs and we save the academic year and we produce graduates and we produce research that matters to transforming people's lives. Is that you have all of these schemes about rotations 4 times a week when the lockdown level is low. When the lockdown level goes high, you say to people, please work from home as far as is possible, but if you have to come in, please do. And I think a last point, Lennox, people forget that there are some people whose work cannot be done from home for the institution and for all of us. Security staff. All security staff can't work from home because they have to secure all of these campuses and buildings, isn't it? Everyone must have a job. The university must still be one of the top choices for staff, students, for funders, for donors and others. So it's a delicate balancing act.
Yeah, it is a balancing act. And I think one of the difficult things is to trace where probably one person contracted the virus.
Exactly. Yes,
Let's talk a bit more about comorbidities of staff who might come in, who've been vaccinated, and potentially if they do fall sick whilst being on campus, would that be the responsibility of the university? Or?
No. I think it will be the responsibility of the university if the university did not create an environment where they ensure that the risk for infection is very low to non-existent. If the university was reckless in that. That is why I say to you is that even when we say people must come at least 3-4 days a week, we also couple it with health, with the health, regulating the health environment within the university, particularly through sanitizing surfaces, encouraging people to follow all of the health regulations. If there are many of them, they must be masked. They must also wash their hands consistently throughout. So liability falls on an institution or an organization when it has not taken reasonably and sufficient measures to ensure that people's health is not put at risk.
I can tell you the university has taken some strong measures. We're recording this from the Future Africa campus, and upon arrival, sanitization, temperature checks, as well as the conference rooms here. There's a lot of sanitizers, the small ones you spoke about. So I indeed do see visibly that those measures have been applied, not only to tick boxes, but essentially to make it a reality.
Yeah, I often laugh at various cases. Remember, I work from the Hatfield campus. So when I go there, it's the same routine. Temperature taken. When I get into my building, which is downstairs, my office is on the 4th floor, I have to sanitize at the door. When I get onto my floor, before I get into my office, sanitization. When I arrive at my desk, there is this sanitization thing. Then I might work there for 3 hours, and like now I'm here.
Yeah.
When I arrived here, the guys didn't say, oh, well, since you've been at your office, you can go through. No, they sanitized me and they took my temperature.
Absolutely.
And I will go to another campus today. And the same's going to happen,
Yeah, absolutely. I must say that does inspire a lot of confidence. Perhaps if you're worried, perhaps you might be a parent and wondering about that. You've heard it from the Vice-Chancellor. Now, Prof, let's talk a little bit more about, you've mentioned a lot about the university being in a really good space, particularly when we got into lockdown. You felt that the university was adapting very well, responding very well to the demands and the challenges that were being brought about, especially going digital. Let's talk a bit more about the future of teaching at the University of Pretoria and learning. Tell us a bit more what you envisage and what's being done.
Yeah, no, I think an exciting era is opened up, one where there's going to be innovation and lots of creativity. And that is what a pandemic does. For me, the pandemic had lots of silver linings. One of those silver linings was in the teaching and learning space. The University of Pretoria, fortunately, had already been experimenting with educational technology since 1998. But that was accelerated a bit during Fees Must Fall, because people couldn't have contact classes again, like now, the university went online. So there was a dress rehearsal, if you like, during the Fees Must Fall 2015, 2016. Now with the pandemic, we are able to also go online from that dress rehearsal. But this is not just about dress rehearsals, being able to experiment, it's about a philosophy. Our philosophy at the University of Pretoria is that the best form of teaching and learning is hybrid or blended teaching and learning. This is an intelligent and creative and innovative mix of contact, being in class, and a lecturer or a professor in front of you, and also complemented with online, or online complemented with contact. That is hybrid teaching and learning. We believe it's the best way of teaching and learning. So as you might know, typically the approach we were following even before the pandemic is that before class, you must go online and do certain things, prepare yourself for class, even do some quizzes, depending on the courses. And then in class, the professor might refer you to things that are online or use online material or electronic material, or videos, presentations, slides, and all of those things. And after class, you would have to return to consolidate your knowledge. So we said in class, you must prepare, you must engage in class, and you must consolidate after class. And people were already doing online assessments, quizzes, and all of this stuff like that, especially in some of the more scientific disciplines where you don't have to write a full-length, written explanation. So we were somewhat prepared for that, and that is why we could smoothly move into the online environment. However, let me be clear. We don't believe what's happening now is the best. Remember, our philosophy is a blend, it's a hybrid. So right now we've been forced onto 100% online everything. And you can't possibly do everything. That is why we have some contact classes now that people are doing it. It's because we believe in that philosophy. So what's the future is? The future is even better. It's something we're going to call hyperflex. And hyperflex is going to be something like this, that a student in a course could go to a contact class. In the same course, you could go to contact lectures. And then for some lectures, you might not go to contact. You might actually do them asynchronously. In other words, material will be put, the professor might even record something and you guys will access it offline. Right? And then you could also then, in a sense, get an online class only. So in one course, say a 14-week course, go to class for 5 weeks. Get asynchronous material, offline material, another 3 to 4 weeks. Online only, another 3 to 4 weeks. That's why we call it hyperflex. The technology allows it. We see the pandemic has taught us that we can do it. And we believe that is the future of learning. It introduces lots of flexibilities. It might also increase access. Imagine people who some students often have to do that. They are holding a job while being a full-time student.
Yeah, true.
So if you have that situation, everything will be recorded, whether it's contact, whether it's asynchronous is obviously recorded, and online is also recorded. So that if you missed stuff one way or another, for you are ill, you're working, you have to take care of parents, some students have children of their own and so on, that you're able to do that. But this is not the one thing I want to be clear about is we believe contact is important. Education is social as well. It's about engaging other people in person. And it teaches you lots of skills. Diversity, appreciation of diversity, engagement, collaboration. It improves your emotional intelligence and understanding. And education is a form of communication. The body language of the person in front of you or persons in front of you matters very much. So creativity, innovation and creativity is the future of teaching and learning at the University of Pretoria.
Incredible. And also, Prof, you mentioned something that's interesting, that innovation at the University of Pretoria is also helping other people who are students to manage their life as well, because they might be working jobs and might be doing other things on the side as well. What people term side hustles, quote unquote. I'm keen to hear a bit more now, because some of the people who have now graduated might be working full-time jobs. In 2019, you also say that there's an opportunity for students who attended the in-person, who didn't attend the in-person graduations, to have that opportunity. Tell us a bit more about how has that panned out. And
that was hugely optimistic, because at the time I believed that the pandemic would be under control or gone. Like I believed and hoped, like everybody did, by the end of 2019. Here is a problem at the University of Pretoria which people don't appreciate. It's a good problem, but a bad one in relation to people wanting a personal moment of fame on the graduation. I love personal graduations as well. And I take as many of them. You will be staggered to hear this. The University of Pretoria runs 31 graduations over 1 month, graduation season. Because we graduate so many students. This year, I think we graduated 11,447 students in the spring graduation only. There have been other graduations recently, and there'll be one in September. There were others in July. There's one small graduation in December. Now, so it's a mammoth task, right, of allowing everybody their space. And now it's 2 years of those. It's 2020 plus 2021. So it's becoming impossible to do that. It was always going to be. If it had been just 1 year of the major graduation in spring, that's a large one, we could make a plan to do that. This is proving to be much more. So you see that we've adapted our graduations now in 2021, that there's an element of people are allowed to come on campus. They are allowed to take pictures. And we're now looking at the technology as well. I've seen some in Japan, where we will allow perhaps even holograms, and because it's a time of technology and innovation. You know, people forget that, of course, there were not many. Even in good times before pandemic, some people were not able to come for a graduation, right? But now we're going to actually try and see how we infuse both a technological use of technologies for people to be able to graduate, but also an in-person dimension, as we did this year. I mean, I think I've seen a couple of universities this week or so doing stage crossings. But the numbers, I mean, are far less than what we would do at the University of Pretoria.
Yeah, definitely.
So I mean, like there'll be 31 graduations in the spring graduations. I often make sure that I try and take 2 graduations per faculty. So that means with 10 faculties, I'll take 20. And I try and take any graduation that is a person getting an honorary doctorate.
Yeah.
Because I know that it's important for the graduate that their Vice-Chancellor is there actually keeping them.
Yeah.
And it's good for family as well. Yeah. And that is why we also, like I said, introduce this allowance that people can come get the certificate, come take pictures, and and also our graduations, I record a speech, so does the Chancellor, and we run them at the time that they should have been run and so on. It's not, of course, what people would like, and it's not what we would want here.
Incredible. Prof, you've mentioned out of this conversation a lot about getting people vaccinated. And I think I'm excited to see that you're taking a stance of having pop-up vaccination sites. So what can we expect when this does come? And, your words to people to really go out there and really get vaccinated. We've seen you yesterday at the Tuks FM OB outside broadcast where you were actually encouraging students to get vaccinated. And it's good to see you also presently pushing the message. It does help to get the numbers up.
Yeah. So as you know, I got vaccinated myself, and really I didn't have any of the side effects. There are 6 or 7 side effects listed for the Pfizer vaccine, which is 2 shots. And I think that is really, science shows that vaccines are safe, and that any side effects that might occur can be handled by medical science. It's not, you haven't heard of hundreds of people, thousands of people dying of being vaccinated. Remember that people must remember vaccinations for COVID come from a long scientific tradition of vaccinating people, including when we were kids. And I think everybody can show you their mark from when they were a baby, when they were vaccinated. Remember when you were a baby, I think you took 5. And all of us alive are testimony to that vaccines work and they keep you alive. And also vaccination has always improved child mortality. In all of those nations and societies where people took vaccinations, more children survived their childhood. And in those societies that they didn't. This is no different. It's simply that now it's a situation where even adults have to be vaccinated. In fact, more adults have to be vaccinated than children have to be vaccinated.
Absolutely.
So I would say to people, embrace this opportunity. It will return you to something closer to the life you led before the pandemic. And also, and that means quite a number of things: restoring our economy, restoring our health, improving our society, and also making sure we actually live. All the scientific tests, studies show that between people who are vaccinated and those who are not, if they are infected, the person who's not vaccinated is likely to fall very seriously ill, and it's likely to end very badly with them passing on as well. We don't want any more of that. I think there's too much sorrow in the nation and in society and among families. Now everybody, I think, knows somebody who died.
Yeah, absolutely. At the beginning, it was
COVID,
like, I don't really know anybody with COVID, but now
everybody actually knows.
Yeah.
And so people can't say you actually do not know. Where there are doubts, I think there's nothing wrong with doubting and questioning things. But I think it mustn't become your life's posture to the extent that you actually end up losing your life because you were so doubtful you didn't actually take something that you could get here. I mean, the truth of the matter is that nobody has said there are no side effects. Scientists have been honest to say you will have side effects and these will occur in this particular way. Yesterday I had to take a COVID test because I'm traveling. I'd not taken a COVID test because I'd never been ill, or if I was ill, it might have been the mildest form of COVID, because I understand there's been something like that.
Yeah.
The nurses were very upfront with me. They said it's very, very uncomfortable. We're going to do it through your nose and we'll twist it in there like that.
Yeah,
it was and they said your eye will tear a little bit. Yeah, it was it's not something you want to do every day.
Yeah.
I did tear a little bit. And then after perhaps an hour, I didn't feel the pain anymore. And then they sent me the results, which were fortunately negative. So I think that the point I'm trying to make, scientists, nurses, and others are being very upfront about vaccines. and this whole situation. So people should take comfort, and people should actually vaccinate and not procrastinate. And the earlier we do it, the better. The president said there's a VOMA campaign. Please, everybody must actually, join the VOMA campaign. And the best way to do it is by vaccinating and persuading someone else to vaccinate.
Absolutely. Prof, we appreciate you putting everything into context. And whilst many people are worried, we brought those questions that we've heard from the public. A lot of people are worried about that, and I'm glad that you've addressed this today. And as always, appreciate your time, and thank you for chatting with us today.
Yeah, thank you. Thank you, Lennox, and enjoy your podcasts. Please continue with them.
Thank you, Prof. Kind words from you. That does bring us to the end of our conversation with the Vice-Chancellor of the University of Pretoria. As you heard it from him, indeed, we must get vaccinated, and the university is certainly doing well at this point in time. Till we meet again, goodbye.